Health authorities here say while the new outbreak is a setback, the situation does not call for alarm. They say they're doing everything to ensure the virus does not spread in the manner it did when Nigeria had its worst outbreak between 2015 and towards the end of 2016. Back then, about 17 states eventually ended up reporting cases of the virus. Now, I have been speaking with one of Nigeria's top virologists about the latest outbreak, and this is how he's been explaining it.
I think there is nothing to worry about. We've been monitoring and responding to suspected cases for over 2 months now. So we've been having samples coming in from a number of our states, and the diagnosis is being made. Because we know that with Lassa fever in Nigeria, it seems to have a season of heightened outbreaks. We usually have a lot of outbreaks during the dry season, and for known reasons, because the virus is carried by rodents, and these rodents, they move into houses when their own natural habitat is burnt down or dried up. So they have to look for food. So that's why during the dry season we have a heightened number of reported cases.
The virologist said in the past the reagents needed for the diagnosis of cases were not always available in the country, which accounted for why the situation was actually bad. But he says everything needed for the quick diagnosis and treatment of cases are now available. He also says the best way to avoid catching the fever is for people to keep the rodents that carry the virus away by keeping their environment clean and covering up foods properly. Deji, Badmus, CGTN, Lagos, Nigeria.
While staying with health issues, Zimbabwean authorities are stepping up efforts to fight a typhoid outbreak in the capital, Harare. The outbreak has once again hit Zimbabwe's oldest suburb, Mbare. Health and local officials say they've instituted measures to eradicate the disease. Some of these include improved water and sanitation, inspection of food handling centers, and a proposed ban on vending. Typhoid is an infection of the digestive system. It's spread through poor food hygiene and contaminated water. It can be prevented through improved water and sanitation. It can also be treated with antibiotics. The disease, though, still kills more than 220,000 people worldwide each year.
You look at what is happening there, the filth that is there, the worms that are breeding on top and under the cabbages that are being sold, and the sewage that is flowing. It's just a shocking, a deplorable state that is a breeding ground, proper breeding ground for disease. So my view is that as long as you don't clean this, you will not get rid of typhoid.